Welcome to 10-Minute Health Tech, the AI-powered podcast where we dive into healthcare technologies and companies so you don't have to. I'm Anthony, and today we're joined by Julia to explore Lumeris, a company making a name for itself in the world of value-based care.
It's a pleasure to be here, and you're right, Lumeris is doing some really interesting things.
Okay, let's unpack this. Value-based care seems to be the buzzword these days, but I think a lot of folks might not totally grasp what it means in practice. Can we break that down?
Absolutely. Value-based care represents a pretty significant shift in how we think about healthcare. Instead of the traditional fee-for-service model, where providers are paid for each service they provide, regardless of the outcome, value-based care focuses on, value. It's about rewarding providers for keeping patients healthy and achieving positive outcomes, while also being mindful of costs.
So it's less about the quantity of treatments and more about the quality of the care provided.
Exactly. The goal is to incentivize a more proactive and holistic approach to healthcare, where prevention and long-term health management are prioritized.
And that's where Lumeris comes in.
Right. Lumeris is helping providers make this transition to value-based care. They offer a comprehensive platform that goes beyond just technology. They provide consulting services, strategic partnerships, and data-driven insights to help providers succeed in this new landscape.
I was reading that they work with over 2 million patients and manage something like $13 billion in medical expenses. That's a huge reach.
It is, and they're working with health systems all across the country, demonstrating a growing interest in this approach to healthcare.
But what really caught my attention was this claim of 3.8x more favorable economics for providers through risk-sharing payer contracts. What exactly does that mean?
That's where things get really fascinating. In value-based care models, providers often enter into risk-sharing agreements with payers, think insurance companies, basically. They agree to share the financial risk for their patients' health outcomes. Lumeris helps providers structure and navigate these contracts to ensure they're not only delivering quality care, but also optimizing their financial performance within these risk-sharing arrangements.
So they're helping providers make sure they're not losing money, while also improving patient care.
Exactly. It's about striking a balance, and Lumeris has a proven track record of achieving that balance. They've reportedly helped achieve $67 million in annual savings through programs like ACO REACH and MSSP.
Okay, now you're throwing acronyms at me. Can you unpack those a bit?
Of course. ACO stands for Accountable Care Organization. It's essentially a network of doctors, hospitals, and other providers who come together to coordinate care for a specific group of patients, particularly those covered by Medicare. REACH and MSSP are two different models within this framework, both designed to incentivize value-based care.
So REACH and MSSP are both about bringing providers together to coordinate care and improve outcomes for Medicare patients.
Precisely. REACH, AAH, which stands for Realizing Equity, Access, and Community Health, is actually the newer model, replacing the previous direct contracting model. It really emphasizes health equity and ensuring strong provider governance. MSSP, or the Medicare Shared Savings Program, it's been around longer and is a more established model.
And Lumeris helps providers participate in both of these programs effectively.
Yes. They provide the technology, the data analytics, and the expertise providers need to manage patient populations, coordinate care, and hit those cost and quality targets these programs set.
It sounds like they're really hands-on with their clients.
They are. They're not just handing over software and saying, good luck. They're working closely with healthcare leaders, offering guidance and support throughout the whole process of transitioning to a value-based care model.
That makes sense. This is a big shift for a lot of providers, so having that support is probably crucial. But it can't just be about saving money.
Right.
What about the impact on actual patient care?
That's a great point, and Lumeris has seen some impressive results on that front as well. They've been able to significantly reduce hospital readmissions and unnecessary emergency department visits among the patients they serve.
Which is a big deal, both for patients and for the healthcare system as a whole.
Absolutely. Reducing those avoidable hospitalizations and emergency room visits not only improves patient experiences, but also plays a big role in controlling costs.
How do they actually achieve these improvements in patient outcomes?
They take a data-driven approach. They use sophisticated analytics to identify patients who are at a higher risk of needing more intensive care or experiencing complications. They work with providers to develop targeted interventions and care plans for those individuals.
So they're using data to personalize care and prevent problems before they become serious.
Exactly. It's about moving from a reactive approach to a proactive one. And it's clearly having a positive impact on patient care.
That's great to hear. It sounds like Lumeris is really blending technology with a human-centered approach to healthcare.
They are. And that's something that a lot of healthcare leaders are praising them for. For example, Dr. Lakshmi Halasiamani, Chief Clinical Officer for Endeavor Health, talks about how Lumeris brings together cutting-edge technology, advanced analytics, streamlined automation, and aligned and intuitive human processes. She credits them with driving clinical impact and program performance while keeping the focus on both patients and healthcare team members.
That's quite a mouthful, but it sounds like she's impressed.
Yeah.
What about other healthcare leaders? Any other noteworthy feedback?
Definitely. Patrick Young, President of Population Health at Hackensack Meridian Health, highlights Lumeris's deep understanding of practice transformation and care management. He credits their robust analytics with saving them from having to hire a whole team of data scientists, which is a significant cost saving.
Interesting. So not only are they helping providers improve care and manage costs, but they're also taking some of the burden off their shoulders when it comes to data analysis.
That's right. They're addressing a real pain point for healthcare providers, and they're doing it in a way that's getting positive feedback from physicians on the ground, which is really important.
All of this talk about improved outcomes makes me curious about some specific examples. What are some tangible results Lumeris has helped achieve?
One striking example is their work with Essence Healthcare, a Medicare Advantage plan. This plan, powered by Lumeris technology and enablement capabilities, has received a 5-star CMS rating, the highest possible rating from the Centers for Medicare and Medicaid Services for 3 consecutive years. That's 2022, 2023, and 2024.
Wow, that's impressive. A 5-star rating for 3 years running is no small feat. It really speaks to the impact Lumeris is having on the quality of care being delivered.
It does, and it's a testament to their ability to help healthcare organizations achieve excellence in this new value-based care environment.
So we've covered a lot of ground here. Lumeris is clearly a major player in the value-based care space. They're working with a vast network of patients, managing billions in medical expenses, and achieving some really significant cost savings and improvements in patient outcomes.
It really is remarkable how Lumeris is bridging the gap between technology and human-centered care. They're not just crunching numbers. They're using those insights to empower providers and improve the patient experience.
It's fascinating how they're tackling these risk-sharing contracts, too. I imagine that's a pretty complex landscape to navigate.
It is. These contracts can be incredibly intricate, and providers often need specialized expertise to make sure they're structured fairly and effectively. Lumeris seems to have a deep understanding of the payer landscape and the nuances of these agreements, which is invaluable for their clients.
So they're not just helping providers deliver better care, they're also helping them protect their financial well-being within this evolving healthcare system.
That's right. It's about sustainability. Value-based care only works if it's viable for everyone involved: patients, providers, and payers. Lumeris seems to understand that, and they're working to create a system where all stakeholders can thrive.
Speaking of data, I'm curious about how Lumeris handles all the information they collect. They must be dealing with a massive amount of data with such a large network of patients.
They are, and they've built a robust and secure data platform to manage it all. It's not just about collecting data, it's about turning it into actionable insights. They use advanced analytics and machine learning algorithms to identify trends, patterns, and opportunities for improvement.
So they're using data to drive better decision-making and ultimately improve care delivery.
Exactly. They're constantly innovating, exploring new ways to leverage data to create a more efficient and equitable healthcare system. For example, they've developed sophisticated predictive modeling tools that can identify patients who are most likely to require costly interventions or experience adverse events.
That sounds incredibly valuable. Being able to identify those high-risk patients early on could make a huge difference in terms of prevention and early intervention.
It does. It allows them to proactively target those patients with personalized care plans, reducing unnecessary hospitalizations and emergency room visits, which, as we discussed earlier, is a win for both patients and the healthcare system as a whole.
It's clear that this data-driven approach is resonating with providers. The fact that they're partnering with major health systems across the country speaks volumes about their credibility and expertise.
Absolutely. They've gained the trust of the healthcare community, which is no small feat. And the feedback from healthcare leaders we discussed earlier really underscores that point.
This whole approach Lumeris has seems to be at the forefront of a major shift in healthcare.
It does. It's an exciting time to be watching the work they're doing, and it makes you wonder what they'll come up with next. What innovations will they pioneer? What other milestones will they achieve? How will they continue to shape the future of value-based care?
I'm curious to see how this all unfolds.
Yeah.
It feels like we're at a tipping point in healthcare, and companies like Lumeris are leading the way.
They are. And they're demonstrating that value-based care isn't just a buzzword, it's a viable and effective way to deliver high-quality, sustainable healthcare.
And it's not just about the numbers, although those are certainly impressive. It's about the impact on real people's lives.
That's right. Ultimately, value-based care is about improving patient outcomes, enhancing the patient experience, and creating a healthcare system that works for everyone. And Lumeris is playing a key role in making that vision a reality. It really is. And as we've seen, it's not just about lofty ideals. It's about delivering tangible results, like those impressive 5-star CMS ratings for Essence Healthcare.
Absolutely. Those kinds of achievements really showcase the potential of value-based care to transform the healthcare landscape. I mean, think about it. 3 years in a row earning the top rating for a Medicare Advantage plan. That speaks volumes.
It really does. It's a testament to how Lumeris is empowering healthcare organizations to achieve excellence in this new environment by providing the tools, the insights, and the support. They're helping providers navigate the complexities of value-based care and deliver truly exceptional patient experiences.
It's clear that Lumeris is not just keeping up with the changes in healthcare. They're actively shaping them.
That's a great observation. They're not simply reacting to industry trends. They're anticipating them, innovating, and pushing the boundaries of what's possible in value-based care. It's exciting to see a company so dedicated to driving positive change in healthcare. And I, for one, am eager to witness what they accomplish next.
Well, I think that about wraps up our deep dive into Lumeris. We've learned a lot about their innovative approach to value-based care, their impressive reach, and the remarkable results they're achieving.
It's been a fascinating conversation, and I hope our listeners have gained valuable insights into this important shift in healthcare.
Thanks for spending 10 minutes with us. And be sure to look for more 10-Minute Health Tech podcasts.